Hello and welcome back to Yashoda Hospitals online segment, Know Your Doctor session. If you've known somebody from the past who've suffered with a kidney stone, they would have told you that it's the worst kind of pain they ever felt. So why do only some people get affected with kidney stones? What are the treatment options available? And most importantly, what are the preventive measures? Let's discuss everything you wanted to know about renal stones in our today's episode. I'm Dr. Lakshmi, and let's welcome Dr. Surya Prakash, consultant urologist from Yashoda Hospitals, Somajiguda. Welcome, doctor.
Yeah, thank you, Dr. Lakshmi.
So, doctor, with more than 2 decades of experience as a urologist and renal transplant surgeon, could you brief us about your journey?
Actually, to talk about my education and training, I did my post-graduation from PGI Chandigarh in 1998. Later on, I did my super specialization, that is MCH Urology from Nizam's Institute of Medical Sciences from 2002 to 2004. Later on, I worked for a brief period as a faculty in NIMS, Hyderabad. Later, I started the Department of Urology in Narayana Medical College, Nellore, where I was as professor and head of the department for nearly 10 years. Later on, I moved to corporate world, joined Yashoda Hospital, Somajiguda, which is a prestigious hospital which is providing world-class care. I have been working here for the past 5 years. I'm heading the Department of Urology in Somajiguda branch. That's about me.
So, doctor, there's never a day in ER which goes without treating a patient with kidney stones. Why do you think it is so common, and which age group is affected the most?
That's a very apt question. Most of the visits to ER are because of ureteric colics. There is no age which is exempt from this problem. Nowadays, especially I can say in the last few years, we are seeing pediatric patients aged 2 years, 3 years coming with kidney stones, and no age is exempt. Even elderly age patients also get this problem. The cause, it is multifactorial. I can't say it is because of one reason. Mainly it is because of the climatic conditions or water intake, our dietary patterns, all these contributes. And of course, to some extent, genetic influence also has got in forming kidney stones. Recently, you mentioned we have operated on a child who is 1 year old having a 2 centimeters kidney stone. So it is very difficult to explain why it has come. So probably some genetic influence which predisposes to the stone formation. Basically, when we talk of kidney stone, urine contains 2 substances which are stone promoters and stone inhibitors. So when this balance is tilted towards stone promoters, stones form. There are certain substances in urine like citrate, magnesium, which are stone inhibitors. When they are present in high concentration, stones doesn't form. Suppose when other substances like calcium, uric acid, calcium carbonate, oxalates, when these are present in higher concentration, then they crystallize and form stone. That's the basic, put it in a nutshell, about the formation of kidney stones.
So we've just discussed that there are certain climatic conditions as well as certain dietary habits which predisposes a patient to the formation of the renal stones. So are there any myths you would like to clear as far as kidney stones are concerned?
Patients usually come to us with some preformed notion that not to eat certain foods, completely avoid certain foods. I have some patients who have stopped eating tomato and palakura for years together. That's not correct. Most important, to put it in like a common man, the diet which commonly predisposes to stone formation is non-vegetarian food. Non-vegetarian food contains a lot of purines, so which gets converted to uric acid and they form crystallization. So too much purine gluttony, what we call, too much involvement in the non-vegetarian food, that is one of the important cause. Another very important cause is water intake. Suppose you consume any food and take enough water, that doesn't crystallize because that becomes soluble in the urine. So inadequate water intake and too much of non-vegetarian food. Increased salt intake. Salt contains sodium, The sodium again helps in crystallization of calcium oxalate in the urine. So excess of sodium in the urine leads to the formation of calcium oxalate stones. So excess salt intake. And nowadays, these junk foods, the one reason I can say why the children are forming stones is because they are indulging themselves in a lot of junk foods. Let it be pizza or burgers. These contains a lot of substances which predispose to stone formation. So these are the common myths, in the sense there is one thing, totally avoiding a substance. Some people that stop eating, drinking milk and totally avoid calcium intake. That is also detrimental. If you don't take enough of calcium intake or daily requirement of calcium intake, the bone gets demineralized. That means the body needs calcium. So from where does it get calcium? From the bones. So the body takes calcium from the bones and the bones become weak. So regular daily intake of calcium is recommended. And one of my patients asked me that, doctor, I eat rice and there are some stones in the rice. Do they form stones? So that is a myth. So there are so many myths. That what I have said is those are the correct things, and if you avoid those things like purine intake, to avoid too much of purine intake, take less salt, take adequate water, take more of fruits, citrus fruits like lemon, oranges, they contain a lot of citrates. So citrates, as I have said, is a stone inhibitor. The more the citrate in the urine, the less is the stone formation. So we tell the patient, take at least daily one glass of lemon juice or one orange per day. Like as the common saying goes, one apple a day keeps the doctor away, one orange a day, I can say, kidney stones away.
Well, I think that's very rightly said, and clearing all the doubts and the myths what people have in their minds as far as renal stones are concerned. So doctor, what are the various treatment options available for the patient with kidney stones? Is it always surgical, or are there any medical therapy as well?
As for any treatment, the treatment ranges from conservative, medical to surgical. Somebody has got a small 4 mm or 3 mm stone in the kidney, we don't have to do anything. Just we tell them to take a lot of water and they pass out the stones in the urine. But some patient has got a 5 mm stone stuck in the ureter, which is causing excruciating pain. That patient needs intervention. So basically, when we talk of conservative management, stones which are very small in the kidney, which are not obstructing to the passage of the urine, can be managed by observation, by measures like plenty of water intake and regular checkups. For stones which are, I can say, size from ranging from more than 5 or more than 6 millimeters, which are present in the ureter. Ureter is a tubular structure which connects our kidney to the bladder. So it drains urine from kidney to the bladder. If the stones are more than 6 mm, which are blocking the ureter and not responding to the medications, they need intervention in the form of ureteroscopy and laser lithotripsy. And the stones which are more than that size, suppose a stone which is present about more than 1 centimeter present in the kidney, can be removed by, nowadays the open surgery is totally gone for kidney stones. I can say the last open surgery for kidney stones I did for maybe 15 years back. The technology has evolved like anything, and any stone in the urinary tract can be treated by minimally invasive methods. So we have got very good lasers, minimally invasive endoscopes, where we can reach the kidney, any part of the kidney through the urinary passage, go into the kidney, see the stone and blast it with a laser. Suppose the stone is more than 2 centimeters, such kind of stones need a procedure called PCNL, where we make a small hole in the back through about a centimeter small incision in the back. Through that we enter into the kidney, see the stone, break it with mechanical lithotripsy or laser and remove the stone fragments. So it ranges from non-invasive, conservative to drugs to minimally invasive procedures. That's about treatment. So the commonly done procedures are, to put it in a nutshell, ESWL is one procedure where the stones are fragmented by giving shock waves from outside. This procedure is nowadays not routinely done because of late we are seeing a lot of hard stones which are not fragmented by ESWL. The other procedure is RIRS, which stands for retrograde intrarenal surgery. This is the latest treatment modality. In this, we go into the kidney with an instrument called flexible ureteroscope, go into the kidney, see the stone and fragment it with laser. The other treatment is PCNL, which is done for larger stones which are more than 2 centimeters big stones. So we have make a small hole in the kidney and remove these stones. So ESWL, RIRS and PCNL for kidney stones. For stones in the ureter, URSL stands for ureteroscopic lithotripsy. Any stone in the ureter can be reached with an endoscope, again through the urine passage, go into the ureter, see the stone and fragment it with laser. That is called URSL. So these are the 4 commonly done surgical procedures or minimally invasive procedures for stones in the urinary tract.
So doctor, we've just discussed about the treatment options available depending upon the size of the stone. So once the patient undergoes the treatment, do you think these renal stones reoccur?
That's a very good question. Removal is only one part of the treatment. So if the patient doesn't follow our instructions, like what I have said, dietary instructions and water intake, the stones do recur. The very big problem with the kidney stones is recurrence. So see, every recurrence again needs some kind of intervention that is an insult to the kidney. So whenever patient comes back with a recurrent stone, so for most of the patients, we do certain tests called metabolic workup. There is some disturbance in this metabolism, let it be some abnormality in the blood or handling of the substances by the kidney. If it is wrong, then kidney stones do form. In metabolic workup, we do certain tests called blood calcium levels, uric acid levels, blood phosphorus levels, and there are certain endocrinological conditions which predispose to stone formation, like hyperparathyroidism, where the calcium levels go up and lead to stone formation. So by doing certain blood tests, we know is there any abnormality in the patient's blood or homeostasis which leads to stone formation. Apart from the blood tests, we do a panel of tests in the urine. It's called 24-hour urinary metabolic workup to see is there any abnormality in the urine which is the cause for stone formation. So we tell the patient to collect the urine for 24 hours and we see so many substances in the urine like 24-hour urine calcium levels, oxalate levels, citrate levels, sodium levels. So we analyze all these things. I think a person has to consult a urologist to identify the cause of recurrent stone formation to prevent again a lot of suffering because of kidney stones.
So you just said that treating the stones is one part and prevention and recurrence of the stones is another story. So what are the preventive measures that one can take if they think they're predisposed to this condition more?
So again, I can put it in two ways. The preventive measures are general preventive measures, specific preventive measures. General preventive measures, as I've said, for any stone, these are the general preventive measures. First and foremost is water intake. How much water intake? Suppose somebody is working in a hot climate and somebody working all the time in the AC. Again, it differs. So what we tell the patient is a person should produce at least 2 liters of urine. That much amount of water we have to take. So in general, I can put it like every day 3 to 4 liters of water. And this water intake should be evenly spaced. Some people, they take early morning, when they get up, they take 2 liters of water and they don't take water till again maybe sometime in the afternoon. So that is not correct. Take water evenly through the day, especially after intake of the food, because that is the time your urine gets concentrated. After half an hour or 1 hour of the food intake, you take enough water, maybe a half a liter or like that, to keep the solutes in solution in the urine. Apart from water intake, general preventive measures like as I've said earlier, decrease purine-rich foods, let it be meat or fish or whatever non-vegetarian foods. Enough of citrate fruits. Citrate is present naturally in fruits like a lemon, orange, I've said. Citrate foods and reduce salt intake. These are the general preventive measures. Specific preventive measures are again decided based on the 24-hour urinary metabolic workup. Any specific abnormality which is found in the urine analysis will be addressed by a specific preventive measures. In that, there are so many drugs. When we do this metabolic workup and when we identify the abnormality, we treat accordingly, and that is called specific preventive measures.
So I think that's rightly said that adequate water is the most important factor in prevention of renal disease or renal stones. So before ending this episode, doctor, what message you would like to give as far as kidney stones are concerned to the general population out there?
See, this is a very debilitating condition. Anybody who has experienced a kidney stone disease will tell that it's a terrifying problem. It causes excruciating pain. So most important is prevention. So we don't want patients to come to us with kidney stones. So how do you do that? If you follow the preventive measures, what I have said, a healthy lifestyle, a balanced diet will help you in formation of the kidney stones, and thus avoid visit to the urologist. So take adequate water intake, 3 to 4 liters of water per day, a healthy diet rich in vegetables. I would recommend a diet predominantly vegetarian diet, rich in fruits and vegetables will keep you away from the kidney stones, and you can avoid a visit to the urologist.
So thank you, doctor, for joining us today. It was wonderful having you here.
Thank you.
So this brings us to the end of this episode. We've been discussing about kidney stones, its preventive measures and treatment options with Dr. Surya Prakash. Do join us for the next week as well. Thank you and stay safe.